Hello and welcome to the topic Schizophrenia in the Psychiatry module. By the end of this session, you should be able to define schizophrenia, outline the differential diagnosis of schizophrenia, discuss the pathophysiology and risk factors associated with schizophrenia, describe the clinical manifestations of schizophrenia, outline the investigations to diagnose schizophrenia, and discuss the management approach of schizophrenia. Let's get started. Schizophrenia is a brain disorder that affects how people think, feel, and perceive things. It is characterized by continuous or relapsing episodes of psychosis. The hallmark symptom of schizophrenia is psychosis, such as experiencing auditory hallucinations and delusions. So, what causes schizophrenia? The causes of schizophrenia are not known. Most likely, there are at least two sets of risk factors which have been identified, and they are genetic and perinatal. In addition, undefined socio-economic environmental factors may increase the risk of schizophrenia in international migrants or urban populations of ethnic minorities. Increased paternal age is also associated with a greater risk of schizophrenia. Now let's take a look at the role of inflammation in the pathogenesis of schizophrenia. We understand that insulin resistance and metabolic disturbances, which are common in schizophrenic population, have also been linked to inflammation. Thus, inflammation might be related both to the psychopathology of schizophrenia and to the metabolic disturbances seen in patients with schizophrenia. Overactivation of the immune system may result in overexpression of inflammatory cytokines and subsequent alteration of brain structure and function. For example, schizophrenic patients have elevated levels of pro-inflammatory cytokines that activate the kynurenine pathway, by which tryptophan is metabolized into kynurenic and quinolinic acids. These acids regulate the NMDA receptor activity and may also be involved in dopamine regulation. How about the roles of neurotransmitter system in the pathogenesis of schizophrenia? Abnormalities of the dopaminergic system are thought to exist in schizophrenia. So the first clearly effective antipsychotic drugs, chlorpromazine and reserpine, were structurally different from each other, but they shared anti-dopaminergic properties. And what these drugs do? These drugs diminish the firing rates of the mesolimbic dopamine neurons and hence known as antipsychotics. Some people with schizophrenia have no family history of the disorder, and these cases may be the result of new mutations. De novo mutations in the exome, which is the part of the chromosome that codes for proteins, seem to be more common in patients with schizophrenia than would otherwise be expected. The risk of schizophrenia is elevated in biologic relatives of persons with schizophrenia, but not in adopted relatives. The risk of schizophrenia in first-degree relatives of persons with schizophrenia is 10%. If both parents have schizophrenia, the risk of schizophrenia in their child is 40%. Concordance for schizophrenia is about 10% for dizygotic twins and 40 to 50% for monozygotic twins. Lastly, schizophrenia is a brain disorder that probably comprises multiple etiology. Impaired cognition or a disturbance in information processing is an underappreciated symptom that interferes with day-to-day life, and people with schizophrenia have lower rates of employment, marriage, and independent living compared with other people. Now let's take a look at the signs and symptoms. The symptoms of schizophrenia may be divided into 4 domains. Positive symptoms, which are psychotic symptoms such as hallucinations, and they are usually auditory, delusions, and disorganized speech and behavior. Negative symptoms include decrease in emotional range, poverty of speech, and loss of interest and drive. The people with schizophrenia has tremendous inertia. For cognitive symptoms, neurocognitive deficits, such as deficits in working memory and attention, and in executive functions, such as the ability to organize and abstract, patients also find it difficult to understand nuances and subtleties of interpersonal cues and relationships. Finally, we have mood symptoms. Patients often seem cheerful or sad in a way that is difficult to understand, and they often are known to be depressed. Now, let's have a look at the diagnostic approach. According to the Diagnostic and Statistical Manual of Mental Disorders, which is the 5th edition, DSM-5, to meet the criteria for diagnosis of schizophrenia, the patient must have experienced at least 2 of the following symptoms, which are delusions, hallucinations, disorganized speech, disorganized or catatonic behavior, or negative symptoms. At least one of the symptoms must be the presence of delusions, hallucinations, or disorganized speech. Continuous signs of the disturbance must persist for at least 6 months, during which the patient must experience at least 1 month of active symptoms, with social or occupational deterioration problems occurring over a significant amount of time. These problems must not be attributable to another medical condition or substance use disorder. So, what are the history details that should be considered in the diagnosis of schizophrenia? Information about the medical and psychiatric history of the family, details about pregnancy and early childhood, history of travel, and history of medications and substance abuse are all important. This information is helpful in ruling out other causes of psychotic symptoms. Are there physical exam findings that indicate schizophrenia? The findings from a general physical examination are usually non-contributory. This examination is necessary to rule out other illnesses. Neuropsychological testing may be considered. Determination of the patient's cognitive weaknesses and strengths can be helpful in treatment planning. Common findings in patients with schizophrenia include poor executive functioning, such as poor planning, organizing, or initiating activities, impaired memory, difficulty in abstraction and recognizing social cues, and easy distractibility. It is sometimes helpful to perform a neurologic examination as a baseline before initiating antipsychotic medications because these drugs themselves can cause some neurological signs. Some patients with schizophrenia have motor disturbances before exposure to antipsychotic agents, and schizophrenia has been associated with left and mixed-handedness, minor physical anomalies, and soft neurological signs. Schizophrenia is not associated with any characteristic lab results. The following should be performed on all patients both at the beginning of the illness and periodically afterwards to rule out other or concomitant illnesses. These are full blood count, liver, thyroid, and renal function tests, electrolytes, glucose, vitamin B12 levels, pregnancy test, urine testing for drugs of abuse, and for cultures and sensitivity. Other tests include urine and serum copper and ceruloplasmin. If there's a strong suspicion of Wilson's disease exists, also you may want to consider a liver biopsy, 24-hour urine collection for porphyrins, copper or heavy metals, dexamethasone suppression test for hypercortisolism, rapid plasma reagent, which is RPR, if there's a strong suspicion of neurosyphilis, HIV antibodies, Lyme antibodies, anti-nuclear antibodies, and some experts suggest that a lumbar puncture be performed to examine cerebrospinal fluid, especially to rule out inflammatory and infectious central nervous system disorders. Now let's take a quick look at imaging studies. Chest radiography is done to rule out pulmonary illnesses or occult malignancies. An EEG is performed, and this is to look at if there are any brain activity abnormalities. There is usually decreased brain volume in medial temporal areas and changes which are seen in the hippocampus, and these can be demonstrated in brain imaging studies such as the MRI studies. The MRI studies also show anatomic abnormalities in a network of neocortical and limbic regions and interconnecting white matter tracts. So, how is schizophrenia treated? Treatment of schizophrenia requires integration of medical, psychological, and psychosocial inputs. It is important not to neglect the medical care of a person with schizophrenia. So, obesity, diabetes, cardiovascular diseases, and lung diseases are prevalent in schizophrenia, and the person with schizophrenia often does not receive adequate medical care for such conditions. Antipsychotic medications diminish the positive symptoms of schizophrenia and prevent relapses. And clozapine is the most effective medication but is not recommended as first-line therapy. That is because it has a high burden of adverse effects requiring regular blood work and has not outperformed other medications in first episode patients. There are numerous guidelines or algorithms for the treatment of schizophrenia and they are available. What are the effects of antipsychotic medications of schizophrenia then? So antipsychotics, also known as neuroleptic medications or major tranquilizers, they work on diminishing the positive symptoms of schizophrenia and they help in preventing relapses. Psychosocial treatment is essential as well, and the best studied psychosocial treatments for schizophrenia include social skills training, cognitive behavioral therapy, cognitive remediation, and social cognitive training. And when is hospitalization or inpatient treatment indicated in the treatment of schizophrenia? Well, although treatment is primarily provided on an outpatient basis, patients with schizophrenia may require hospitalization for exacerbation of symptoms because caused by non-compliance with pharmacotherapy, if there is any concomitant substance abuse, adverse effects of toxicity of medications are seen, if there's any medical illnesses that needs to be treated, psychosocial stress, or the waxing and waning of the illness itself. And hospitalizations are usually brief and they are typically oriented towards crisis management or symptom stabilization. Let's take a quick look at antipsychotics. Antipsychotics are a group of drugs used in the management of schizophrenia and other forms of psychosis, mania, and agitation. They are usually divided into typical and atypical antipsychotics. The atypical antipsychotics were developed due to the problematic extrapyramidal side effects which are associated with the first generation of typical antipsychotics. So examples of extrapyramidal side effects include Parkinsonism, acute dystonia, such as sustained muscle contraction known as torticollis and oculogyric crisis, and this may be managed with procyclidine. Other examples of extrapyramidal side effects include akathisia, which is severe restlessness, and tardive dyskinesia, which is the late onset of chorioathetoid movements, abnormal, involuntary, and may occur in 40% of patients. It could be irreversible, and the most common is chewing and pouting of the jaw. The Medicines and Healthcare Products Regulatory Agency has issued specific warnings when antipsychotics are used in elderly patients, and these are basically highlighting the increased risk of stroke and the increased risk of venous thromboembolism. Other side effects include antimuscarinic effects such as dry mouth, blurred vision, urinary retention and constipation, sedation and weight gain, raised prolactin levels, impaired glucose tolerance, neuroleptic malignant syndrome such as pyrexia and muscle stiffness, reduced seizure threshold, as well as prolonged QT intervals, particularly seen with haloperidol, which is a type of a typical antipsychotic. Now, to summarize, we understand that schizophrenia is a brain disorder that affects one's thinking, feeling, and perception on things. And this is driven by the abnormal levels of dopamine as neurotransmitters in the system. You may want to look out for positive, negative, cognitive, and mood symptoms as mentioned. Apply a diagnostic approach which begins with identifying the apparent criteria based on the DSM-5 manual, taking a complete thorough history to exclude any concomitant medical illnesses or substance abuse disorder, performing a thorough physical examination to exclude any underlying neurological problems, and the investigations are mainly targeted to exclude other concomitant existing illnesses, as well as to exclude any space-occupying lesion or central nervous system problems. And lastly, when it comes to management, you may want to consider the medical management of the patient's underlying medical problems, as well as administrating medical therapy such as antipsychotics to control the positive symptoms as well as to prevent relapses. Psychosocial and inpatient hospitalization may be considered for refractory or difficult cases to treat. We have come to the end of this topic. Thank you.